Hello, we are the Chicago Health Coalition for Black Lives, the political education branch. Our team is composed of Maya McCoy, Peter Lorenz, Khamillah Zimmer, Morgan Harris, Taylor So, Syeda Akila Ali, Sarah Agamah, Vikrant Garg, and Yomaira Silva. The Chicago Health Coalition for Black Lives was assembled in June 2020 in response to police brutality and police murders. We are a group of health professionals and medical students of different institutions throughout the Chicagoland area, and we came together as a political education working group. A lot of our work is also in collaboration with UIC Medical Colloquia. This is a part of the University of Illinois College of Medicine curriculum, which was created in 2017 for topics that weren't necessarily covered in a traditional medical curriculum, where students were required to attend at least 6 sessions per semester that were topics that were more recent and that were student planned as well.
In contrast to the banking model of education described by Paulo Freire as the system in which the teacher is the epistemological authority while the student passively receives information, CHC for BL's political education team emphasizes a participatory model of education by fostering a non-hierarchical, peer-led space in which each participant has pre-existing knowledge and experience to contribute. Organizers of the curriculum work directly with invited speakers to tailor didactic content for each session and to develop questions and prompts for reflection and discussion. CHC for BL's team members sought out speakers whose community-based wisdom and organizing experience could help clarify topics in our current socio-political climate. Members coordinated materials with speakers, co-facilitated sessions, posted resources online, and did outreach to advertise sessions. To facilitate asynchronous learning, recordings of each session were also uploaded to chcforbl.com. Feedback forms were sent to attendees and subsequent sessions were adjusted to increase accessibility. Some sessions were coordinated with faculty from UIC so students could receive credit for courses.
From late July 2020 through this January, we have conducted 9 sessions and we have 5 of these 6 additional sessions planned in spring. 5 of these sessions enabled UIC medical students to gain medical colloquia credit. As you can see, the themes of the sessions ranged wide from career advice to organizing to policing in prisons and immigration justice. Overall, we had around 91 average RSVPs with a standard deviation of 45, and live attendance ranged from 10 to 55. As you can see, some of the most well-attended sessions were the one on policing and prisons, especially the session on structural violence, the school-to-prison nexus, and the leaky pipeline in careers and healthcare. Our feedback was overall positive, with 100% of respondents through the UIC's official class surveys indicating that the sessions met learning objectives.
And here is just some feedback taken from the UIC colloquia comments. In conclusion, the political education arm of our collaborative CHC4BL was formed by medical students from across the Chicagoland area, and we were able to share resources, information, and social justice organizing work across our institutions. We leveraged institutional resources to organize these sessions, and we were able to bring together learners and educators who are interested in public health, racial justice, and political organizing. And we found that this model of political education was a feasible way to incorporate the knowledge of these people with lived experience and grassroots organizing experience into the medical education curriculum. And we were able to create an explicitly political education in doing so. And the virtual format of this year allowed us to engage with people across the country. If you'd like to join any of our upcoming sessions, you're welcome to reach out at chc4bl.com or on Twitter or Instagram. Our handles are on the page. And if you're also planning on building out a virtual curriculum of your own, we have here linked some of the resources that we've used to organize that we found really helpful. Thank you for your time listening to us today.